Welcome to the E-classes. I'm Dr. Jyoti Sharma, professor in the Department of Anatomy at RNK Memorial Homeopathic Hospital and Medical College. Today we will learn about thoracic duct. Thoracic duct is the largest lymph vessel in the body. It is easily seen and looks like a vein. It is thin walled. The lymph in the thoracic duct appears milky due to the presence of fat globules in it. Here we can see the thoracic duct starting from the cisterna chyli at the level of T12 vertebra, ascends up and terminates here. When we see the appearance, it is beaded in appearance due to the presence of numerous valves. One such valve is constant at the opening of the duct in the left jugulo-subclavian junction. The valve presents regurgitation of blood into the duct. When we see the length, it is about 45 centimeter long. Here again we can see the thoracic duct having a beaded appearance, and this is the termination at the left jugulo-subclavian junction, and the length is about 45 centimeter long. When we see the course of thoracic duct, it passes through abdomen, thorax and the cervical regions. In the abdominal course, it extends from lower border of T12 vertebra. It begins in the abdomen as the upward continuation of the sac called cisterna chyli at the level of lower border of T12 vertebra. Entry in the thorax, it enters the thorax by passing through the thoracic opening in the diaphragm. Here we can see this is the starting of thoracic duct from the cisterna chyli, and this is the aorta, and this is azygous vein ascending up. This is the aortic opening in the diaphragm, where this is the esophagus. This is the esophagus, this is aorta, and this is the azygous vein. In the aortic opening, it lies to the right of the aorta, and the vena azygos or azygous vein lies to the right of the thoracic duct. In the thorax, in mediastinum, in the posterior mediastinum, the thoracic duct ascends between the aorta and the vena azygos up to T5 vertebra. It then continues upward but inclines towards the left side and passes deep to the arch of aorta. The thoracic duct now comes to lie along the left margin of esophagus. In this position, it runs upward through the superior mediastinum and into the lower part of the neck. In the neck, at the level of the transverse process of C7 vertebra, the thoracic duct arches laterally behind the carotid sheath, which contains the common carotid artery, the internal jugular vein, and the vagus nerve. As the duct passes laterally behind the carotid sheath, it passes in front of vertebral artery and vein, sympathetic trunk, the thyrocervical trunk, the phrenic nerve, and the medial margin of scalenus anterior muscle. The terminal part of the duct ascends in front of the first part of subclavian artery. Here we can see the relation. This is the aorta, this is the thoracic duct, this is the azygous vein, this is the aortic opening of diaphragm, this is esophagus, and this is the termination. When we see the termination of thoracic duct, it ends by opening into the junction of the left subclavian vein and the left internal jugular vein. At its termination, a bicuspid valve guards the opening. This prevents leakage of venous blood into the thoracic duct. Here is the termination. We can see here, this is the left internal jugular vein and this is the left subclavian vein. Now we see the area of drainage of thoracic duct. The thoracic duct carries lymph from both sides of the body below diaphragm and from left side above the diaphragm. It carries lymph from both of the upper limbs, the pelvis, the abdomen, the left half of the thorax, and the left half of head and neck, and the left upper limb. Now we see the factors for the propulsion of lymph. The raised abdominal pressure in expiration, coughing, and sneezing is one of the factors which propel the lymph upwards. In spite of this, there is contraction of muscles in the wall of cisterna chyli, alteration of pressure within the thorax during ventilation, pulsation of adjacent aorta, and valves in the wall are the factors which propel the lymph upwards. Now we see the tributaries of thoracic duct. Most of the lymph from the abdomen reaches the thoracic duct through the cisterna chyli. Thoracic duct also receives some vessels directly from upper lumbar lymph nodes. Within the thorax, the duct receives vessels from lymph nodes of the region. Near its termination, the thoracic duct receives left subclavian trunk from the left upper limb and left jugular trunk from the left half of the head and neck. It may also receive left bronchomediastinal trunk from upper part of the thorax. We see the tributaries of thorax here in the diagram. This is the lumbar lymph trunk. This is the intestinal lymph trunk. This is cisterna chyli. This is descending thoracic lymph trunk. This is thoracic duct, and this is left bronchomediastinal lymph trunk. Now we see the applied anatomy of thoracic duct. Thoracic duct contains smooth muscles of lymph flow in it. Thus, frequent movement is critical for humans to properly move the lymph into the circulatory system and prevents lymph stasis in certain areas of body. Obstruction of thoracic duct. Thoracic duct may be obstructed by growth of mature filarial parasites, sometimes causing bursting of lymph vessels. The condition is manifested by collection of chylous fluid in pleural and the peritoneal sacs. Injury to thoracic duct is vulnerable to damage after the thoracic, particularly esophageal surgery. The injury is life-threatening if duct is lacerated. It is thin-walled and colorless, hence more prone to injury during surgery in the posterior mediastinum. Thanking you.